Well, I'm absolutely delighted now to be joined by AMA President Jeremy Lazarus. Jeremy, welcome.
Thank you.
Thank you very much indeed for joining us today. Now, as everybody knows, you're a psychiatrist, aren't you?
That's correct.
So you're at home here.
Very much at home with my colleagues.
Now, I mean, a lot of issues that we could get stuck into, but let's start at the top. The Affordable Care Act. What's the implication been for medical profession and psychiatrists for the Affordable Care Act?
Well, the Affordable Care Act is going to be incredibly important to our patients and the psychiatrists that take care of them because we're going to have about 30 million people who are now going to have access to coverage that they have not had before. There's going to be the end of pre-existing condition denial, so a lot of our patients who had a previous diagnosis, for example, will be able to get coverage. There'll be end of lifetime limits of coverage, so those of our patients who have chronic illnesses are going to be able to be treated for as long as they need to be treated. We have young Americans under the age of 26 are going to be able to be on their parents' insurance policies. So there are many benefits that are going to be incredibly important for access and coverage for our patients. When you couple that with the improvements in Medicare, the fact that Medicare co-payments are going to come down to the same level as they are for other medical services, the implementation of the Mental Health Parity Act, we're going to have about 60 million Americans who suffer from mental illness who are going to have better coverage beginning in 2014. So incredibly important advances.
And that sounds like a good thing.
Very good thing, very good thing.
But inherent in that, I imagine, the 60 million more Americans, there's quite some challenges there as well.
There are some challenges, and it's going to be rocky and bumpy as the act is implemented. And we're going to also have to look at perhaps different ways of delivering care, for example, more coordinated care, more integrated care, care that is led by psychiatrists, but working with teams to deliver care to larger groups of patients who are going to be coming into the healthcare system.
Talking about that working together, I mean, you, as we said, are a psychiatrist, and how has the APA and the AMA worked more closely together?
Well, the APA and psychiatry is incredibly well represented at the AMA. We have about 38 delegates at our House of Delegates, which is our policymaking body, that are psychiatrists. We have 2 psychiatrists on the board, myself and Patrice Harris from Atlanta, Georgia. We have many psychiatrists who are on councils of the AMA, sections of the AMA, in many leadership positions at the AMA. So psychiatry is very well represented, very well respected, and we have an opportunity to actually influence things that happen at the AMA in a very meaningful way.
Well, thank you very much indeed for talking to us today. We really appreciate that. Thank you very much.
Thank you very much.
Thank you.